The heart is a hollow muscular pump. A normal heart is composed of 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. Deoxygenated blood, shown as blue, returns from the body into the right atrium. Next, blood moves into the right ventricle, which pumps it through the pulmonary artery to the lungs to be oxygenated. From the lungs, oxygenated blood, shown as red, returns to the heart into the left atrium through 4 pulmonary veins. It then enters the left ventricle, which pumps blood through the aorta to the rest of the body. In the uterus, the fetus receives oxygen from the placenta, so blood can bypass the lungs. Blood bypasses the lungs in two ways. One way is through an opening in the wall between the right and left atrium called the foramen ovale. The other way is through a connection between the aorta and pulmonary artery called the ductus arteriosus. Normally, these openings close a day or 2 after birth because of increased blood pressure in the left atrium causes the foramen ovale to close, and the presence of oxygen causes the ductus arteriosus to close. The baby's heart will then continue to pump blood normally through the lungs to the rest of the body. Atrial septal defect is a hole in the wall between the 2 upper chambers of the heart. Before birth, it is normal to have an opening called the patent foramen ovale in this wall. This opening usually closes shortly after birth. Sometimes the wall between the chambers doesn't develop completely. As a result, an abnormal hole called an atrial septal defect is left in the middle of the wall. This opening allows blood to move between the upper chambers, which increases blood flow to the lungs. If the hole is large enough, the increased blood flow leads to enlargement of the heart and can also damage the blood vessels in the lungs. It can also lead to abnormal heart rhythm due to injury to the heart muscle. Most children do not have symptoms, but those with a large defect can have slow growth and rarely a condition called congestive heart failure. Treatments for atrial septal defects may include medications for symptoms, but the definitive treatment is closure by either cardiac catheterization or surgery. If the hole is large enough or hasn't closed by the age of 2 to 5 years, a catheter or surgical procedure may be necessary. During a catheter procedure, a tube called a catheter is inserted through a small incision in the child's groin. From there, the catheter will be directed through the blood vessels to the child's heart. Next, the doctor will place a device called an atrial septal occluder across the defect to plug the hole. The device will stay in the heart and prevent blood from closing between the upper chambers. Then, the catheter will be removed from the body. When the hole is too big or when there is no place to attach the device, open heart surgery is necessary to close the hole. To begin, the surgeon will make an incision in the chest. Once the heart is reached, the hole will be closed with a patch. The incision will be closed and covered with sterile dressings.